debate is crucial because Scotland is experiencing an alcohol and drugs-related public health emergency. On that, Miles Briggs is not wrong, and we're pleased he secured this debate. And we do recognise that across the chamber there are passionate and strong views. In the 10 years since the previous drug and alcohol strategies were published, there have been over 15,000 substance-related deaths. And for context, 15,000 is the equivalent of the entire population of Larkhall, one of the towns that I represent. So if we continue at this rate, in 10 years' time, the population equivalent of another small town will have been wiped out too. So that is a state of emergency, and that's what the amendment in my name seeks recognition of. This is my first opportunity in the chamber to congratulate Joe Fitzpatrick on his ministerial appointment, and I do believe him to be sincere in tackling the issues outlined, and I very much welcome his comments on stigma and language. But I'm sure the entire health team who are here from the government today would agree that they can't have the luxury of a honeymoon period, because people's lives are at risk today, tomorrow and the next day. There were 934 drug-related deaths and 1,235 alcohol-related deaths last year alone. So that's 2,169 preventable deaths in just 1 year. Today, we agree that we can support the wording in the Tory motion and the Scottish Government's amendment, and in doing so, we're going to knock out our own amendment because we do want to find consensus. It's not about cheap points in this chamber, but we don't agree with all of the proposals on the table and some of the rhetoric that we've heard today. If the Government does declare this alcohol and drugs public health emergency, or declares it an emergency, this public health crisis, and puts the full force of all of government behind this, it will have the full support of our benches. And whilst we can support the wording of the Tory motion, I have to say we don't support the strategy released to coincide with today's debate. The strategy, which does say some decent things, I fear is dangerous in other parts, and it appears to be shaped by Tory ideology rather than evidence-based solutions. Today's debate is a topic close to my heart. Yes, happy to.
Miles Briggs.
I thank the member for the intervention and for letting me taking this intervention. When will the Labour Party be putting forward their ideas? Because we've heard nothing from them. They don't seem to have any ideas. And as we've seen today, the government's just published their strategy ahead of this debate.
Monica Lennon.
Don't dare, Miles Briggs. If you are really genuine about this, you don't rush out a strategy on a few bits of paper to get ahead of the government and bounce them into a strategy. In Miles Briggs' strategy, he talks about the financial costs of the drugs crisis. What about the financial cost of austerity? There is no mention of that, and the word poverty does not feature. So the strategy from Miles Briggs isn't worth the paper it's written on. But if I can continue, Presiding Officer, because we are passionate in this, and I know Miles Briggs is too, but following my members' debate on the alcohol and drugs-related deaths last year, people across Scotland got in touch with me, and I'm sure they got in touch with other members to share their own family story of the devastation that alcohol and drug harm causes. And it's crucial to countless families across Scotland that we do get this right. And I don't think we should come to this chamber today and have to react to different statements, because we've heard some fantastic contributions from all of the stakeholders across Scotland. And I think in Scotland there are some things that we're leading the rest of the world on. And I want to pay tribute, and I'm sure Miles Briggs does too, to Alcohol Focus Scotland, to SHAP, to the Scottish Drugs Forum, Scottish Families Affected by Drugs and Alcohol. And it's their input and their evidence that has helped Mr Fitzpatrick improve the strategy that he started off with, and hopefully members across the chamber too. But today is not a day for cheap points, because a lot of us know from family experience and through supporting constituents that the human stories behind alcohol and drug harms are always complex, often chaotic and invariably tragic. One issue that we on these benches have with the Tory strategy is that it fails to recognise that people experiencing addiction are in the grip of an illness. We're talking about illness. So there are some positive policies in there, but I fear that we have a strategy which reinforces the stigma around drug harm. And if we're going to have policies around, trying to arrest and punish people to get them out of recovery, and you're going to feel the full force of the law if you don't cooperate. Well, that's the kind of rhetoric that's coming across, and I would say to Miles Briggs that that is not helpful. In contrast, and I don't often agree and support the Scottish Government, but a rights-based approach is the correct one, and a stated commitment to the right to health does have the potential to make a real difference to people's lives. Other colleagues, Alex Cole-Hamilton, Jenny Mara, have made the point that alcohol and drug partnerships must be properly resourced, and I don't agree that the government has always played fair on that. A lot of it's to do with funding, but there are issues around how resources are spent and the transparency around it, and I'm sure others will make those points. We do agree that a new approach is required. When 15,000 people have died during the course of the previous strategies, we all have to be brutally honest and say that it's not just a refresh that is required. This is a public health emergency, and the Scottish Government should declare that for the good of the country. It's imperative also that I believe the Scottish Government does commit to targets to focus and reduce alcohol and drug harm. Preventative action, harm reduction and reducing health inequalities will be key to tackling this issue meaningfully and effectively. Now, death is not the only indicator or measure of alcohol and drug harm. There are over 60,000 problematic drug users in Scotland. And though it's difficult to identify the true number of problematic alcohol users, there were over 36,000 alcohol-related hospital admissions last year alone. Specialist medical responses are urgently required for alcohol-specific illnesses such as fetal alcohol spectrum disorder and alcohol-related brain damage. And I would ask the Minister, as it looks likely our amendment will fall today, if he supports the asks in our amendment. The treatment of alcohol and drug misuse must include recognition of the social and economic root causes, and that's where the Tory strategy fails. Addiction doesn't discriminate, and it can affect all walks of life, but it's deprived communities that are more likely to be impacted by drug and alcohol harm. I wanted to speak on stigma. I was pleased that the Minister mentioned that. So in conclusion, Presiding Officer, we do support the Scottish Government's amendment. I'm disappointed that our amendment is likely to fall today. So I'll finish with a question which I think gets to the crux of the matter. Does the Minister agree that this alcohol and drug-related crisis is an emergency? Will the Scottish Government declare a public health emergency and work with all of us for the good of the people of Scotland? I move the amendment in my name.